Our nation has not faced a public health threat as challenging as the opioid epidemic since the beginning of the global AIDS crisis. Besides an increase in opioid deaths, the CDC has reported that the opioid epidemic has stalled the decline in new HIV infections among people who inject drugs and increased hepatitis C infections. Recently, the White House commissioned a report from an expert panel to develop recommendations to address the nation's escalating opioid-related deaths. Among the recommendations was for government agencies to combine, integrate, and present a comprehensive data source to help address the opioid crisis. amfAR's Opioid Health Indicators database does exactly that and more. Maps from the database have appeared in the New York Times and in local news broadcasts, and have been used in congressional briefings and meetings and at the National Academy of Sciences. amfAR's opioid database has 4 main functions that are easy to remember and use. Find it, map it, track it, and keep it. Click here to view national maps of various indicators. You can also search by typing in your state, county name, congressional representative, or congressional district. And similar search boxes are located here at the top of the page. Scroll down the home page to find at-a-glance national data on specific indicators. Generate interactive national maps for any indicator. And view maps with data across several years. You can also click anywhere on a national map to generate a state map. Hover anywhere to see the name and data for a county in a state, and even compare different data indicators and side-by-side maps for any selected state. You can also map data by congressional districts, or even show the distance to a syringe services program or an opioid treatment facility that offers medication-assisted treatment. You can track multiple data points in the database at the same time. Scroll to the bottom of a national or state page for deeper data dives, such as how your state stacks up against other states. You can even compare counties within each state. For instance, many counties in this state don't have a single provider licensed to treat opioid users with buprenorphine, a recommended and highly effective treatment. You can also view funding to states from specific government agencies, get a quick read of your state's policies to address opioids, HIV, and hepatitis C, and even keep track of the latest opioid-related news for any state. Exporting the information from the database is a snap. Just click on the PowerPoint icon next to any map or figure, and a PowerPoint slide of the image pops up on your screen. More comprehensive state or congressional district information is also available for download as PDF data summaries with customizable maps. You can view a list of all the federal data sources used for the database and even download the raw data to conduct your own analyses. And this is all free. If you have any questions or comments about the database, contact us at dbinfo@amfar.org. Knowledge is power. Start learning how the opioid, HIV, and hepatitis C epidemics are affecting your community.